I am going to go over 5 supplements that can reduce pain, improve function, and decrease swelling and stiffness related to arthritis. If you are suffering from osteoarthritis, rheumatoid arthritis, or psoriatic arthritis, you should watch this video. I will go over the scientific evidence, the doses that you need, and I will also share with you how you choose a good quality supplement product. Let's begin.
Rheumatologistoncall.com.
Hi, I am Dr. Diana Girnita, a double board certified physician that treats patients with arthritis every day. As you know, arthritis affects millions all over the world, causing pain and discomfort. My patients are interested in natural ways to treat arthritis, and they are particularly interested in taking supplements. If you're watching this video, I bet you are interested too. Maybe you heard a friend, a colleague, that he was taking a supplement, or maybe you have seen a supplement advertised on the TV, and now you're wondering, is this good for you? Is there any scientific evidence, or is just another product that will sit on your counter? First, let's talk about collagen. Collagen is the most abundant protein in your body, and it plays a crucial role in maintaining the strength of your skin, nails, and bones. The problem is that collagen formation in our body slows down with age. Collagen formation starts declining at the age of 30, and every year will decline with 1%. Smoking, drinking alcohol, too much sun, menopause, too little exercise, or sleep will speed up the loss. And if you have rheumatoid arthritis, the collagen will also be affected. There are many collagen products available on the market. However, not all are well absorbed. Research supported the use of collagen peptides or hydrolyzed collagen, as these supplements seem to offer a broken down form of collagen that it's easier for the body to absorb. Studies suggest that collagen supplementation may lead to stronger skin, nails, but also cartilages in your joints. Studies like this one that looked at collagen hydrolysate or collagen peptides in patients with osteoarthritis showed a good effect, especially in people with knee osteoarthritis. In patients with rheumatoid arthritis, the effect of collagen peptides is still debatable. Collagen might have some anti-inflammatory properties which can be helpful in patients with RA, but as of yet, it's not clear the evidence of benefit. Yes, we do need more research. It might not be harmful, especially for patients that develop osteoarthritis secondary to rheumatoid arthritis. Now, if you are interested in trying collagen peptides, I will leave a link in the description of this video that might be helpful for you. However, collagen can be derived also from food, like bone broth, or chicken skin, or fish, and it can also be found in beef or gelatin-based foods. Now, if you are learning and enjoying my educational video, give a thumbs up and subscribe to my channel. In this way, the video will spread this good quality information and more people will benefit from it all around the world. Let's move to the second supplement, glucosamine and chondroitin. These are natural compounds found in the cartilages of your joints. You can buy glucosamine and chondroitin individually, but most often they are sold together in a single supplement. Initial studies in animals showed that glucosamine and chondroitin might have anti-inflammatory properties, might slow down cartilage deterioration, and reduce the pain. Now let me present you some studies. One study published in 2008 in 1,600 people with osteoarthritis, it was called the GATE study, looked at the combination of glucosamine and chondroitin versus the supplements taken separately versus celecoxib and versus placebo or an inactive pill. The study showed that the combination of glucosamine and chondroitin didn't offer significant relief to participants in general, but it did help a small subgroup of patients with moderate to severe knee arthritis. However, in a follow-up study from 2010, these supplements showed to improve pain and function, although no better than placebo or NSAIDs like celecoxib. There are also other studies, like the study MOVES trial, which was published in 2016, that showed that the combination glucosamine and chondroitin, if it's taken for 6 months, is as effective as celecoxib to reduce pain and swelling in people with knee osteoarthritis. Now, celecoxib is a very potent anti-inflammatory medication, but the combination of glucosamine and chondroitin had no side effects. And this is important because if you have a history of heart disease or history of a GI bleed, it is best to avoid NSAIDs like ibuprofen, naproxen, or celecoxib. Instead, you may use these supplements because the current studies support the use in knee osteoarthritis and they are considered safe. Now, please note, these supplements can interact with blood thinners like warfarin or coumadin, or may increase the blood sugar. So if you are a diabetic, pay attention. Fish oil is one of the most popular supplements on the market. You have probably heard about the benefits of fish oil for your heart, or to decrease cholesterol or triglycerides level, but have you heard about fish oil for arthritis? Fish oil is extracted from fatty or oily fish, such as trout, mackerel, sardines, or salmon. Fish oil is the source of omega-3 fatty acids, and these omega-3s are considered essential fatty acids because your body cannot produce them, so you either take them from food or supplements. Many studies linked the use of omega-3s with reduced levels of inflammation. Why? Because omega-3s block an enzyme called COX-2, and this is the same enzyme that NSAIDs, like ibuprofen, are blocking. So in this way, they can reduce inflammation. Fish oil supplementation was studied in many autoimmune diseases. This 2017 systematic review looked at the benefits of fish oil for patients with rheumatoid arthritis, lupus, gout, and osteoarthritis. Of 22 trials involving rheumatoid arthritis patients, almost all found that fish oil significantly reduced joint pain, stiffness, swelling, and very important, decreased or eliminated the need to take NSAIDs. 5 of 7 studies found that fish oil improved lupus activity in the short term. In patients with osteoarthritis, the effect of fish oil was not so great, but there are studies that say that fish oil may reduce the pain, even for patients with gout. Omega-3 seems to prevent gout attacks. In patients with psoriatic arthritis, fish oil showed to decrease psoriasis of the skin and also decrease the pain in the joints. If you want to learn more, watch my video about supplements for psoriasis and psoriatic arthritis that I posted in this channel. Fish oil was also shown to reduce the need of using NSAIDs in patients with back pain. One study showed that using fish oil for 4 months, about 60% of patients discontinued to take their NSAIDs. And this is very important, as I said, because these studies did not report additional side effects. The recommended dose is between 2 and 4 grams per day. But I would like to warn you that some fish oil products might be contaminated with mercury. You should take fish oil with a meal, as other dietary fats will improve the absorption of omega-3 fatty acids. But before you start fish oil, discuss it with your doctor, because fish oil may interact with your blood thinner, blood pressure medication, or contraceptive medication. Another useful supplement for arthritis is Boswellia. Boswellia is a resin herbal extract from Boswellia tree. The compound called boswellic acid is the one responsible for the powerful anti-inflammatory effect. Like omega-3s, boswellic acid can block the same enzyme COX-2 and reduce inflammation and cartilage damage that is happening in arthritis. A 2014 study that included multiple randomized controlled trials found that patients with osteoarthritis that use Boswellia 100 milligrams per day for 3 months had less pain, improved function without serious side effects. In another study from 2018, that looked at 20 supplements for osteoarthritis, Boswellia was again among the standouts. In another study from 2020, more recent, that included 500 patients, again confirmed the benefits of using Boswellia. How about patients with inflammatory arthritis like rheumatoid arthritis or psoriatic arthritis? There are some animal studies that point towards benefits, but we still don't have studies in humans. The recommended dose is 100 milligrams daily for patients with osteoarthritis. But be careful, as Boswellia may increase side effects of other drugs like antidepressants or ibuprofen or immunosuppressants. The last supplement that I would like to talk about is turmeric. Turmeric or curcuma longa is a staple of the traditional Ayurvedic medicine. Turmeric is also a common ingredient in the Asian cuisine. The main active ingredient in turmeric is called curcumin, and this is the one responsible for the beneficial effect. There are more than 10,000 studies on turmeric and more than 120 clinical studies, and these studies support the potent anti-inflammatory effect. Curcumin also acts on the COX-2 enzyme, like fish oil and Boswellia, and like NSAIDs. The effect? It will decrease inflammation. Turmeric was studied in patients with osteoarthritis, rheumatoid arthritis, and psoriatic arthritis with good effect. In 2016, a study that included many randomized controlled trials found that 1 gram per day of curcumin reduces osteoarthritis pain and inflammation, as well as NSAIDs like diclofenac and ibuprofen. And this is very important because, as I said, if you have contraindications like heart disease, kidney disease, or a previous GI bleed, NSAIDs are not an option for you. In a more recent study in 2020, this was a randomized controlled trial in 70 patients with knee osteoarthritis. They compared curcumin with an inactive pill or placebo. Patients that received curcumin 1 gram daily for 3 months had less pain compared to placebo. Now, in patients with rheumatoid arthritis, showed that using curcumin 1 gram per day for at least 90 days resulted in decreased inflammation, decreased pain, and decreased number of tender and swollen joints. And you have to know that dose matters, because this study showed that the effective dose was 1 to 1.5 grams of curcumin per day. Plus, you should choose a product that is enhanced with pepper that will also help the absorption of turmeric. Be careful that high doses of turmeric can act as a blood thinner and can worsen the effects of blood thinners like Coumadin or warfarin. Now, I will explain to you how to select a good quality supplement. You have to know that FDA, or the Food and Drug Administration, does not evaluate the effectiveness, the safety, or the quality of these supplements or the ingredients that are in them, which means there is no guarantee that what the supplements companies claim that they have inside, it's actually true. And the best way to ensure the quality of a product is to look for one that has been certified by a third-party company. Being evaluated by a third-party company, the supplements will receive a certificate of analysis. And this certificate will attest that what they claim there is in the supplement, it's actually there. And the same components and doses remain the same between different batches. There are different certificates like NSF or USP or Consumer Lab, and I would strongly recommend you to look for these certifications. My advice is that with any supplement, start with a low dose and increase gradually while monitoring the effect. Always reevaluate the effect on your body every 2 to 3 months. If you see a benefit, continue. If you don't see it, stop it. For my patients with rheumatoid arthritis, I have designed a rheumatoid arthritis journal where they can write down every day or every week their progress with arthritis while taking any treatment, including supplements. Check this out and get a copy for you. You will find the link in the description of this video. Always, before starting any supplement, talk to your doctor. As I said, some supplements can interact with other medications and can cause side effects that you don't want. For those of you that are interested, I put some links in the description of this video to the products that meet certifications criteria. Please keep in mind, I'm not endorsing these companies and I cannot guarantee the effectiveness of these products. Please do your own research and discuss them with your doctor. Now let me know, what did you try in terms of supplements and what worked for you? Leave me your comments in the bottom of this video and share with me your experience and share it with the world. If you enjoyed this video, please don't forget to like, share, and subscribe to my channel. Until the next time, stay informed and stay healthy. Thank you.
Rheumatologist on call.com